Hello, this is CeeCeeG. I have a subject today that I want to talk about because I want to kind of let you in a little bit on some of the things that I go through as far as my health is concerned. And I have this medication and I'm just haven't been feeling right. And I just want to do like a self-evaluation of what I'm taking, what I'm doing. And this one particular medication that I've been taking because I'm diabetic and I have neuropathy, pain sometimes in my legs and arms and things, numbness. But there are a lot of side effects of this medication that kind of, I want to look into because I've had some issues with falls in the past and things. And, of course, my vision, as you can see in my videos, I have really thick glasses. And dealing with diabetes and, neuropathy, you have some type of weakness in your legs anyway. So, but I'm really going to think about not taking this anymore because now I'm not saying this for those of you who take it because some people take it for other reasons. And we'll get into that, but you do as you're directed by your doctor, and always talk to your doctor. So I do have an appointment coming up, and I will be talking to my doctor about it because I'm wondering if a lot of what I'm dealing with is contributing to the fact that I'm taking this type of medication. I want to make sure I'm doing the best thing possible as far as my health, and and do what I got to do to get there to be more healthy each day. So in this picture, I have a picture of my pills. I didn't take the picture, with my label because I don't want people knowing my business, but these are the pills that I take. These are the Gabapentin. Now, I haven't taken them in a couple of days because I wanted to see if it's a change, outside of what I've been dealing with and everything. But it's just been, there's a lot of stuff to this medication. It does help with other things. But as far as I'm concerned, for me, I'm starting to have a double look or double take on this medication. So I don't want to hold you up. Let's get into this and we'll discuss. And make sure you always be working on your health. Always be working. And just because your doctor says, oh, you should get this, you should get that, you got to know what's best for your body. And when you know you don't feel a certain way, you have to be an advocate for yourself. So let's get into that. Now let's talk about what is gabapentin used for. Now I looked it up on Google so I can get the Google what it's used for. So according to Google, gabapentin, which is also called Neurontin, is a medication used to help manage certain epileptic seizures and relieve pain for some conditions, such as shingles, postherpetic neuralgia, dizziness, and drowsiness are common gabapentin side effects. Weight gain and uncoordinated movement are possible side effects. So, far as the movement, I'm going to tell you, I know of one particular, a couple of times, I have fallen. And I don't know if it's because I had my socks on my feet and I have carpet all through here on my steps. And this one particular day, I was going down the steps. Next thing I know, I fell head first down the steps, legs up, head down. And I hollered out to my husband. And as I'm going down, I'm trying to grab onto the rail to break the fall. And I got the rail, and my husband tried to help me up. So I was like 3/4 of the way down the steps. And he was trying to help me get up, but it was kind of hard trying to get up from an upside down position. So I ended up going down the rest of the steps, and I would just lightly tap my head on the closet door that's at the bottom of the staircase. And, I was like, like, what the, what happened? It just happened so fast. And so I thought, well, maybe is it because, sometimes even carpet can be really slippery. So I said, well, I bought these little step covers on top of the carpet because, I've had accidents on near the steps. I have to be really careful. And I'm kind of like not with my gait. I'm sometimes a little rocky. I feel like I'm going to fall. It's like a baby trying to walk again. Sometimes I feel like I'm going to fall. So that's why you see me with a cane in my videos. I also have a rollator that I use in the house sometimes because it has a seat in it. So I can do my chores and sit down. I'll show you a video of that later on. But it's been like one incident after the other. I mean, like, it's really hard. It's really challenging when you're dealing with your vision and other health issues that are taking residence as well. So I just wanted to get into it. I'm going to probably not be taking this because of some of the side effects, and we'll get into that next. What are the side effects of gabapentin? Now, I have a whole litany list of things that are side effects that cause alarm for me. So one of them is feeling tired, which I do, dizziness, that headache, I've had that. I'm not going to tell you everything, but a lot of these things I have had. Nausea and vomiting, fever, difficulty speaking, recurring infections, memory loss, weight gain, movement problems, coordination problems, clumsiness, being unsteady, tremors, jerky movements, eye problems, unusual eye movements, double vision, nystagmus disorder, sedated state, and viral infection, continuous, uncontrolled back and forth or rolling eye movements, pain or swelling in the arms or legs, painful or difficult urination, sore throat, sores, ulcers, or white spots on the lips or in the mouth, swollen glands, unusual bleeding or bruising, abdominal or stomach pain, blistering, peeling or loosening of the skin, clay-colored stools, coma, confusion, convulsions, dark urine, decreased urine output, diarrhea, difficult or troubled breathing, fast or irregular heartbeat, increased thirst, shallow breathing, itching or skin rash, joint pain, a large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs, loss of appetite, muscle ache or pain, pale or blue lips, fingernails or skin and red skin lesions, often with a purple center, red irritated eyes, unpleasant breath odor, vomiting of blood, yellow eyes or skin, blurred vision, cold or flu-like symptoms, delusions, dementia, hoarseness, loss of strength, lower back or side pain, swelling of the hands, feet, or lower legs, trembling or shaking. According to a Google search, in summary, we can conclude that although it happens infrequently, gabapentin may cause myotoxicity. Oh, all these words. Okay. Rhabdomyolysis and renal failure, even in patients whose renal function was previously normal. So I kind of like looked up some of these things. The myopathies, it says definition, myopathies are neuromuscular disorders in which the primary symptom is muscle weakness due to dysfunction of muscle fiber. Other symptoms of myopathy can include muscle cramps, stiffness, and spasms. I've had spasms, stiffness, and cramps. I've had all of them. It says, what damage does the gabapentin do to the body? It says, call your doctor right away if you have a rash, itching, trouble breathing, trouble swallowing, or any swelling of your hands, face, or mouth while you are using this medicine. Gabapentin may cause vision changes, clumsiness, unsteadiness, dizziness, drowsiness, sleepiness, or trouble with thinking. So, in conclusion, with this gabapentin, I have some questions because a lot of some of this stuff, of some of those side effects, I have gone through personally, and I'm wondering if that has anything to do with what I'm dealing with, because sometimes your doctor can prescribe medication and for one problem, but it gives you 99 other problems. And I'm not about that 99 problem life. I'm not. I want my health restored. I want to be able to do the things that I want to do, and I'm over it already. I've been over it. So, just always just contact your doctor. Make sure that you're doing what's necessary for your health, and don't let nobody tell you otherwise about how you feel in your body. Because I'm at this point, I'm about to start looking at everything and seeing what's going on with me, because I'm done. I'm done. So I hope that you learned something about this, even in your own medications and things. Look at it, see, if you're going through some of those side effects, because it might be just the medicine that you're taking that's causing the problem. So I hope that you all learn from this, and I will see you on the next one. Thank you so much for listening to this video, and I hope that you all have a blessed and wonderful day. Peace.